Hey everyone, it's Name of the Creator hiring the ghostwriter. Let's talk about that time of the month. You know, the one that often comes with cramps, bloating, and a whole lot of discomfort. Period pain is incredibly common and can really put a damper on your daily life. Whether you're struggling to focus at work or just feeling plain miserable, dealing with period pain is no fun. But here's the good news. You don't have to suffer in silence. There are effective ways to manage those cramps and get back to feeling your best. In this video, we're diving deep into the world of pain relief options specifically designed for period pain. We'll break down the best over-the-counter pills, discuss their pros and cons, and help you figure out which one might be the right fit for you. So grab a cup of tea, get comfy, and let's tackle those period woes together. First up, let's talk about ibuprofen. You might know it by its brand name, Advil. This little pill is a powerhouse for period pain relief. Ibuprofen is part of a group of drugs called NSAIDs, or non-steroidal anti-inflammatory drugs. It works by reducing inflammation throughout your body, tackling one of the main culprits behind those painful cramps. One of the things I love about ibuprofen is that it's generally very safe and effective for most people. It's readily available over the counter, so you don't need a prescription. Plus, it comes in various forms, like tablets, capsules, and even liquid gels. When it comes to dosage, always follow the instructions on the packaging. Typically, for period pain, you'll take 200 to 400 milligrams every 4 to 6 hours as needed. But remember, it's always better to start with a lower dose and see how your body reacts. While ibuprofen is generally safe, be aware of potential side effects like mild stomach upset, heartburn, or dizziness. If you have any pre-existing medical conditions, like ulcers or kidney problems, talk to your doctor before taking ibuprofen. Overall, ibuprofen is a fantastic option for period pain relief. It's effective, readily available, and generally well tolerated. But remember, everyone is different, and what works wonders for one person might not be the best choice for another. Always consult with a qualified healthcare professional for personalized guidance. Let's move on to another effective pain reliever for those pesky period cramps, naproxen. You might recognize it by its brand names like Aleve or Midol long-lasting relief. Naproxen is another type of NSAID, just like ibuprofen, but it has a few key differences. One of the biggest advantages of naproxen is its long-lasting effect. While ibuprofen typically provides relief for 4 to 6 hours, naproxen can keep those cramps at bay for 8 to 12 hours. This means you can take it less frequently throughout the day, which is super convenient. Naproxen is also very effective at reducing inflammation and pain. Like ibuprofen, it's available over the counter in various forms. For period pain, a typical dose is 220 milligrams every 8 to 12 hours as needed. However, it's crucial to start with the lowest recommended dose and see how your body responds. Be aware of potential side effects like stomach upset, heartburn, dizziness, and headache. If you have a history of ulcers, kidney or liver disease, or heart problems, consult with your doctor before taking naproxen. Overall, naproxen is a highly effective option for long-lasting relief from period pain. Its extended duration of action makes it a convenient choice for many. Now, let's shift gears and talk about acetaminophen, another common pain reliever for period cramps. You might know acetaminophen better by its brand name, Tylenol. Unlike ibuprofen and naproxen, acetaminophen is not an NSAID. Instead of targeting inflammation, it works primarily by blocking pain signals in the brain. This makes acetaminophen a good option for those who experience stomach sensitivity with NSAIDs. It's generally considered gentler on the stomach. Acetaminophen is effective for mild to moderate pain, including headaches, muscle aches, and period cramps. It's available over the counter in various forms, such as tablets, capsules, and liquid gels. For adults, the typical recommended dose is 325 to 1,000 milligrams every 4 to 6 hours as needed, not exceeding 3,000 milligrams in a 24-hour period. While acetaminophen is generally safe when used as directed, be aware of potential risks. Taking too much acetaminophen can be harmful to your liver, so never exceed the recommended dosage. Avoid consuming alcohol while taking acetaminophen, as it can increase the risk of liver damage. If you have any pre-existing liver conditions or are taking other medications, talk to your doctor before taking acetaminophen. Overall, acetaminophen is a valuable option for period pain relief, especially for those who experience stomach sensitivity with NSAIDs. Let's talk about aspirin, a classic pain reliever that's been around for ages. While it might not be the first thing for period pain, aspirin can be surprisingly effective. Like ibuprofen, aspirin is an NSAID, reducing inflammation throughout the body. However, aspirin has unique properties that set it apart. It has a blood-thinning effect, beneficial for some but risky for others. For period pain, aspirin can reduce cramps and inflammation. Consult your doctor if you have ulcers, bleeding disorders, or allergies. Not recommended for children or teens recovering from viral illness due to Reyes syndrome risk. Be aware of potential side effects like stomach upset and nausea. If you experience unusual side effects, stop taking aspirin and contact your healthcare provider. Now, let's dive into a lesser-known but highly effective option for period pain, mefenamic acid. Mefenamic acid is often prescribed for more severe menstrual cramps when other over-the-counter options haven't provided sufficient relief. It belongs to a group of drugs called phenamates, which are NSAIDs with a particular knack for tackling period pain. Mefenamic acid targets prostaglandins, hormone-like substances that play a key role in inflammation and pain during menstruation. By blocking the production of certain prostaglandins, mefenamic acid can significantly reduce menstrual cramps and discomfort. Unlike some other NSAIDs, mefenamic acid is typically taken only when you need it for period pain. The usual dose is 500 milligrams 3 times a day, but always follow your doctor's instructions. It can take a couple of cycles to reach its full effectiveness, so don't be discouraged if you don't experience complete relief right away. Common side effects include diarrhea, nausea, and stomach upset. If you experience more severe side effects like vomiting, severe stomach pain, or signs of an allergic reaction, stop taking the medication and seek immediate medical attention. Overall, mefenamic acid is a powerful ally in the fight against period pain, especially for those who haven't found sufficient relief with other options. Use it under the guidance of a healthcare professional and be aware of potential side effects. We've covered a lot of ground today, exploring various over-the-counter and prescription options for period pain relief. From ibuprofen to naproxen, acetaminophen to aspirin, and even mefenamic acid, there's a whole arsenal of tools available to help you tackle those pesky cramps. Remember, finding the right pain relief option is a personal journey. What works wonders for one person might not be the best choice for another. If you're struggling with period pain, don't suffer in silence. Talk to your healthcare provider about your symptoms and explore the best treatment options for you. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more videos on women's health and wellness.